My name is Gilles Lesieur. I'm from France, Albi, and I perform in private practice cataract surgery and refractive surgery and also glaucoma. It was a pleasure for me to speak of MST. MST is a company that was involved since 2003 in BMX, and I performed BMX since the beginning after Alio and Hargawal. And it was a company very important for me because this company developed small instrumentation like capsulorhexis forceps. And now my pleasure is to use all this instrumentation. I like to use the curved scissors to enlarge the capsulorhexis forceps. And also I try last couple of weeks the new device Chang retractors, and it was a very difficult case with a 90-year-old patient with pseudoexfoliation, and the capsular bag was very unstable, and with these retractors it was easier to perform the surgery and to have a big result to treat the glaucoma with sclerotomy, deep sclerotomy, and to perform phacoemulsification. I think that if you are a good surgeon, you need to have appropriate tools and the best tools. So it's like in the Middle Age, when you see all practitioners has his own tool, so it's difficult to have a universal tool. I develop a lot of tools like hydroshopper, capsulorhexis forceps, and I would like to perform some new tool in glaucoma surgery with MST. And it's difficult to have a universal tool. So if you have a good tool, I think that it's 50-50. You have to be a good surgeon, but you need also to have a good tool and a very accurate. In comparison with other companies, I think that MST tools are the Rolls-Royce of the tool. You can use the capsule retractors. I think that it's a very good idea to perform this with a Chang retractor, and the evolution, I think that there is another device with there is a Chang and another one. At the beginning, I try to support the capsule when you have a big weakness of the zonule. I try to use the Iris retractor, but it's a little bit aggressive. And with Iris retractor, you can have some tear of the rhexis. So the Chang is a bit high-D, and I try it in a very difficult cases, as I told you, and it was very successful because the patient had 20/20 Perino 2 the day after, so it was great. I think that the cataract surgeon could be compared to a pilot because it's a short time of activity, but you don't have to miss something. It's very fast with the surgery, and if you miss a step of your surgery, you can fall. So it's very important to have the good tool, to have a checklist before, and my OR is organized like a cockpit. I have my nurse that is specially like a copilot. She tells me what I have to do, what I have to perform. I like to use image guided, and everything is on the OR, and I can say what I have to do during the surgery to avoid complication. In the future, I think that it's what you have to reach, and to have the same results than in aeronautic in the flight. And yes, because it's very important for the patient to have zero complication. So we need the good tools, a good checklist, a silent during the surgery, everything in a cocooning effect for the surgery.